Based on our discussions and our meetings and the level of erectile dysfunction, the desire of the patient for sexual activity, the patient's current quality of life, and treatment options tried, and interests, we've chosen penile prosthesis to help restore you and the patient more to what they remember as far as normal sexual function, with the ability to obtain and maintain an erection substantial enough for sexual intercourse with an adequate experience reliably. During the procedure, the patient's given general anesthesia. The bladder is drained and a small incision is made in the upper part of the scrotum. The inflatable components are then able to be placed inside the erectile bodies of the penis after exact measurements are taken. A reservoir that contains the fluid that allows the implant to expand is implanted in a discrete location where it is not seen or usually felt. The connections are then made to a pump that's placed inside the scrotum, and the incision's closed. Patients should have clearance from a cardiologist if they have a history of heart disease or actively see a cardiologist. We will need to have them be able to stop any antiplatelet medications or blood thinners commonly given to patients for atrial fibrillation, history of blood clots. These will need to be stopped for a time period before and a time period after. You will need transportation on the day of your penile prosthesis placement, someone to pick you up from the hospital and drive you home and help you fill your post-operative prescriptions, given the fact that you will undergo general anesthesia and be under the influence of narcotic. The days following your procedure, you will be discharged from the recovery room. There will be some prescriptions for pain medication and some antibiotics. Patients usually go home with a special type of dressing that provides support and compression. There'll usually be a drain and oftentimes a catheter. Those things usually stay in place about 48 hours. We usually bring you to the clinic afterwards and take these things out there. The days prior to surgery, we will have you obtain clearance from a cardiologist or FC specialist for major medical issues, and you will have that obtained. We'll hold antiplatelet and blood thinner medications for a period of time. For diabetics, very tight blood sugar control, even months preceding the process of placing a penile prosthesis will help with the outcomes. We generally do not have patients shave prior to the surgery. We do have you shower with antibacterial soap the night of the procedure. The day of surgery, you should bring a change of clothes. You should have a driver with you and someone that can actually take you home and allow you to have your post-operative prescriptions filled and picked up. The day you come, you should bring your identification and applicable insurance cards. You should also bring a list of your current medications. You should not shave before your surgery. The day of the operation, you will check in downstairs and in admitting. At that time, you will be brought up to the pre-anesthesia area. This will be several hours before the procedure, as the preoperative nurses need to intake and insert proper medications in the computer. The anesthesiologist and nurse anesthetist will then visit with you. IVs will be started. Proper surgical consents will be signed. Instructions will be given to you and your family member or transportation. After checking in early for this, you'll be in the preoperative area. I usually come and visit with you before time, answer any remaining questions, and then at that point, it's time for the surgery to begin. They'll take you back to the operating room, and at that time, you'll be given a general anesthesia when you're placed completely asleep. At that point, the surgery will be performed. When you're done, you will then go to the recovery room. While in the recovery room, they'll take care of any postoperative pain or nausea needs. They'll allow you to completely clear your anesthesia. After this is done, they will contact your transportation or family member, give them any applicable instructions that you desire us to do. We'll give as little or as much information as you want. Your prescriptions usually will be electronically sent to your pharmacy. They'll ensure you're adequately awake and able to be stable for discharge. At that time, you'll be discharged home with instructions on postoperative care and follow-up